PAD stands for Peripheral Arterial Disease, which is a condition that affects the blood vessels that carry blood to the legs, arms, stomach, and kidneys. PAD is caused by a buildup of plaque in the arteries, which leads to a narrowing of the vessels and reduced blood flow. PAD affects about 8 million people in the United States, and the risk increases with age. Symptoms of PAD may include leg pain or cramping, especially during exercise, numbness or weakness in the legs, and slow-healing sores or infections on the feet or legs. PAD can be diagnosed through a physical exam, blood tests, and imaging tests like ultrasound, MRI, or angiography. Lifestyle changes like quitting smoking, eating a healthy diet, and exercising regularly can help manage PAD symptoms. Medications like blood thinners, cholesterol-lowering drugs, and drugs that widen the blood vessels can also be used to treat PAD. In severe cases, surgery or other procedures may be necessary to restore blood flow to the affected area. Left untreated, PAD can lead to complications like chronic pain, gangrene, and even amputation of the affected limb. People with PAD also have an increased risk of heart attack and stroke. Prevention is key when it comes to PAD, and maintaining a healthy lifestyle and managing other health conditions like diabetes and high blood pressure can help reduce the risk. PAD is more common in people who have other risk factors for heart disease, such as high blood pressure, high cholesterol, smoking, obesity, and a family history of heart disease. PAD can be managed effectively with proper medical care and lifestyle changes, but it is a chronic condition that requires ongoing management. People with PAD may need to see a vascular specialist, such as a cardiologist, interventional radiologist, or vascular surgeon, for treatment. Exercise is an important part of managing PAD, but it should be done under the guidance of a healthcare provider and may need to be modified based on the severity of the condition. In addition to lifestyle changes and medications, there are also minimally invasive procedures that can be used to treat PAD, such as angioplasty and stenting. PAD is not just a problem for older adults, it can also affect younger people, particularly those with a history of smoking or diabetes. Early diagnosis and treatment of PAD can help prevent complications and improve quality of life for people with the condition. Education and awareness about PAD is important, as many people may not recognize the symptoms or understand the importance of managing the condition. PAD can also affect the blood vessels that supply the brain, leading to a type of stroke known as a cerebrovascular accident. People with PAD may be at increased risk of other health problems, such as kidney disease and erectile dysfunction. The ankle brachial index, ABI, is a simple test that can help diagnose PAD and determine the severity of the condition. People with PAD should avoid smoking and limit alcohol consumption, as these habits can worsen the condition. In some cases, PAD may be an early sign of more widespread atherosclerosis, hardening and narrowing of the arteries, throughout the body. People with PAD should also take steps to prevent foot injuries and infections, as these can be more serious and take longer to heal in people with reduced blood flow to the feet. PAD can be a serious and potentially life-threatening condition, but with proper management and care, many people are able to lead active and healthy lives. PAD can be more common in people who have a sedentary lifestyle or who sit for long periods of time. The American Heart Association recommends that people over the age of 70 or anyone with risk factors for PAD should have a one-time screening for the condition. In addition to lifestyle changes and medications, there are also surgical options available to treat PAD, such as bypass surgery and endarterectomy. Regular monitoring and follow-up with a healthcare provider is important for people with PAD to ensure that the condition is properly managed. People with PAD may need to take extra precautions during air travel, such as wearing compression stockings, walking regularly, and staying hydrated, to reduce the risk of blood clots. People with PAD should be careful when using hot or cold therapies, such as heating pads or ice packs, as they may not be able to feel the temperature as well due to reduced sensation in the affected limb. In some cases, PAD may be a warning sign of other health problems, such as diabetes or high blood pressure, and may require further evaluation and treatment. PAD can have a significant impact on quality of life, and people with the condition may benefit from support and resources, such as counseling or support groups. Research is ongoing to develop new treatments and improve understanding of PAD and its impact on health. PAD can affect people of all races and ethnicities, but it is more common in African Americans and Hispanic Americans. People with PAD may need to undergo regular tests, such as blood tests and imaging studies, to monitor the condition and assess the effectiveness of treatment. Some people with PAD may experience depression or anxiety related to the condition, and may benefit from mental health support. Quitting smoking is one of the most important steps people with PAD can take to reduce the risk of complications and improve overall health. People with PAD may also benefit from working with a physical therapist or occupational therapist to develop an exercise program or learn techniques to manage symptoms like pain and cramping. PAD can be a chronic and progressive condition, but with appropriate management and care, people with the condition can maintain a good quality of life and reduce the risk of complications. In some cases, PAD may be asymptomatic, meaning that a person may have the condition without experiencing any symptoms. PAD can also lead to non-healing wounds or ulcers on the feet or legs, which can be difficult to treat and may require specialized care. People with PAD should be vigilant for signs of infection, such as redness, swelling, or discharge from wounds, as they may be at increased risk of infections due to reduced blood flow. In rare cases, PAD may lead to gangrene, a serious condition that can result in tissue death and may require amputation. PAD can also be a risk factor for heart attack and stroke, and people with the condition may need to take additional steps to manage these risks. People with PAD may benefit from compression therapy, which uses pressure to improve blood flow and reduce swelling in the affected limb. PAD can be a challenging condition to manage, and people with the condition may need to work closely with a healthcare team to develop a comprehensive treatment plan. People with PAD should also take steps to manage other health conditions, such as high blood pressure and diabetes, which can worsen the condition. Regular exercise, such as walking, can be an effective way to improve symptoms of PAD and reduce the risk of complications. Education and awareness about PAD is important not just for people with the condition, but also for healthcare providers, who may need to be vigilant for signs and symptoms of the condition in their patients.